Afternoon. Kelly, let me know when we're good. Welcome everyone. Thank you for being here today and for everyone listening in on our live stream. My name is Mary Kay Larson. I'm the Communications Director for Lake Oswego School District. With me today we have many from our Lake Oswego School District Administrative Leadership Team, as well as our student services and district nurse. We also have with us our Lake Oswego School District school board members, as well as representatives from the city and public health officials. Speaking today will be our superintendent, Dr. Laura De La Cruz, as well as Dr. Sarah Present. She's the Deputy Tri-County Officer for Clackamas County. And then we will open it up to questions after they both have given their statements. With that, I will turn it over to Laura.
Good afternoon. Yesterday evening, I received a call from the Oregon Health Authority stating that it was investigating a presumptive case of the novel coronavirus disease known as COVID-19 that was discovered in one of our staff members who works at Forest Hills Elementary. Before I continue, I want to say that we care deeply about this person's health and our thoughts are with him and his family. I was notified minutes before the news release announcement, and we immediately notified our staff, our families, and our community about the presumptive case in Lake Oswego School District. Although we were advised that we do not have to close Forest Hills, we elected to close it in an abundance of caution and care for the children and adults in our schools and community. Following is a rationale for closing the school through Wednesday, March 4th. February 19th was the last date on which the employee who became ill was in the school. It was discovered last night on February 28th that he has a presumptive case of novel coronavirus disease, COVID-19. The timing of our decision to close Forest Hills until March 4th is intended to allow us to clean the school thoroughly, let local, state, and federal public health officials conduct their investigation, allow everyone to take a few days off to stay healthy, and allow the recommended waiting period of 14 days after exposure to run its full course. At this time, we believe it will be safe to return to Forest Hills after March 4th. Public health officials have assured us there is no need to close other schools in the district at this time, although it could be considered if Oregon Health Authority identifies more cases beyond Forest Hills. At this point, it appears that this person likely only had close contact with a few individuals and that they have been asked to stay home from work or school for 2 weeks. They've been asked to monitor themselves for symptoms and stay in regular contact with their healthcare providers and the local public health department. In cooperation with the Oregon Health Authority and local public health, we are actively monitoring students and staff absences and reports of illness. We ask that if any staff, students, and community members are feeling ill, that you remain at home. We have canceled all activities in Lake Oswego School District facilities this weekend. We expect to reopen all schools except Forest Hills on Monday, March 2nd. We have brought in an industrial cleaning company this morning to evaluate the Forest Hills building so that deep cleaning can begin, using recommendations from the Oregon Health Authority and the Center for Disease Control. Additionally, we're taking precautionary steps to clean and disinfect all schools and all school buses by Monday before schools open. From the information that we have at this time, Forest Hills is the only school in the district that has had exposure. Again, Oregon Health Authority has assured us there is no need to close other schools in the district at this time, although this could be considered if more cases arise beyond Forest Hills. For those of you who are affected by the school's closure, it is recommended that you rest at home, spend time with your family over the next few days, seek medical attention if you or someone in your family becomes symptomatic. The Lake Oswego School District administrative team, the school board, and I have been working around the clock in consultation with the Oregon Health Authority to closely monitor all aspects of this situation. As the Oregon Health Authority continues its investigation of all potential others who may have come in contact with this staff person, and to communicate with our community. As a district, we are taking firm and decisive action, and we will continue to closely monitor the situation. The health and well-being of our students, our staff, and our community are paramount, and we will continue for the health and well-being of our students to drive our decision-making. The very best thing we can all do right now is to remain calm and pay close attention to the advice and guidance of our public health officials. At this time, I'm going to turn this over to Dr. Sarah Present, who has been working closely with us and with the Oregon Health Authority throughout this process. Thank you.
Thank you. Hello. Again, I'm Dr. Sarah Present. I'm the Deputy Tri-County Public Health Officer for Clackamas County, and I'm a family doctor. I'm also a mother of a child in elementary school, and I understand how scary the situation can be. I want this whole community to know that your concerns are valid and that we are listening to them, and I want to just give you some assurance of what we are doing to address the situation. I first want to repeat some of the statements that were just made, but also assure you that the temporary closure of Forest Hills Elementary does not mean that everyone in the community has had significant exposure or is at high risk of getting this disease. The reality is that this virus is new, and we're still determining the levels of risks. Closing the school is done out of an abundance of caution and to give us time to further assess the situation and while ensuring the safety of the community. The time frame of this closure is cautious and will be sufficient to ensure that it's safe to resume normal activities when the school opens, unless there are new cases or other changes, which we will let you know about immediately. Again, at this time, there's no indication that other schools in the district are at risk. There's no reason to limit your exposure to children or others in this school community due to the potential exposure, unless they themselves are ill. People who have had significant contact with this case are known to be at high risk of contracting the illness are being contacted directly and being monitored by public health. As we learn more about this disease, we will know more about how infectious it is. There are some diseases like measles that we know are very infectious and can spread by spending short time in a room with somebody with the disease. This is not expected to be that infectious. There are other diseases like tuberculosis that take several hours of very close contact to get the disease from somebody who has it. What we know about this novel coronavirus disease, or COVID-19, is that it's probably somewhere in the middle. It is not as infectious as measles. It is looking to be more like influenza. This means that it takes some prolonged period of time with somebody who is ill and close contact in order to contract the disease from them. Other ways that you can contract the disease from somebody who's ill is if you are in direct contact with their respiratory secretions. That means if they cough or sneeze directly on you and you touch your mouth, your nose, or your eyes. At this time in our community, if you do have a respiratory illness, it is still much more likely to be a common cold or influenza, which is still circulating, than it is to be the COVID-19 disease. We do know that the best way to protect yourself at this time and to protect the public is through proven techniques to limit spread of respiratory illnesses. This means staying home at the first sign of illness. Cover your coughs if you are ill. Wash your hands and wash high-touch surfaces in your home frequently. If you would not otherwise seek medical care for a respiratory illness like a cold, now this is not a reason to do so now. Please take care of mild symptoms at home as you would otherwise do, and don't expose others unnecessarily. If you do have more severe symptoms such as difficulty breathing or an inability to stay hydrated, call your medical provider to discuss your symptoms with them and decide whether you do need to be seen or if it's safe to still continue to stay home. If you need to be seen, you can make a plan for care and evaluation as needed that will not expose others. Our main focus is to limit spread in the community. If you are ill and you are doing okay, please limit your exposure to others. Your medical provider can communicate with public health around your testing needs. There is no need for testing people without symptoms at this time. As we learn more about the situation, we will communicate with you. If we have any new cases or new concerns in our community, we will address the further needs for school closures or other recommendations for the public as needed and as they arise, in close coordination with the Oregon Health Authority and the Centers for Disease Control and Prevention. Thank you.
Thank you. At this time, we'll take questions. If you may, please introduce yourself when you ask your question. Start with
Dr. De La Cruz, Mike Benner from KGW. You mentioned that this individual, your employee, does not typically have contact with students and that may have had contact with several others. Did that contact happen at the school or elsewhere? And the reason I ask is that we've heard that there's a chance maybe some employees visited this person in the hospital before the positive test came back. And if you accept.
So to clarify, this employee does not have the type of contact that we believe would be required to transmit this virus. And yes, some other employees did visit this employee in the hospital, and they are, have been asked to stay at home as well and seek medical advice and guidance.
Can you tell me a little bit about the company that's being brought into cleaning? Are they a specialist in hazardous infectious disease or something like that? Can you elaborate a little bit more on that?
What I can tell you is that we have contracted with a company called ServPro, who is evaluating the school at this time so that we can make plans for deeper cleaning.
Can you talk, I'm J.V. Krishnan from the Oregonian. Can you talk more about how you tracked, where this person might have gone? It's been more than a week since they were here. How do you track things that far back as per what contact they may have had with school employees or people elsewhere in the community?
I'm going to ask Dr. Present to respond to that because she's working closely with the investigation.
Public health officials are well trained in contact investigations. We are working closely with Washington County as well as the Oregon Health Authority to do in-depth interviews and detailed evaluation of potential exposure sites as we would with, as we do with any outbreak and any communicable disease that's reportable. So there are in-depth interviews that happen, and we are working on finding all potentially exposed people.
Are there other areas in either Washington County or here in Oswego that you can say that that person was at, that other people might have been at for that? Can you identify any of those places?
I can say that all of the identified places have been released at this time.
Dr. De La Cruz, you spoke a little bit about cleaning at Brandon Channel 12. Can you speak exactly to when this will begin? Has it already begun, and when officials will enter?
What I know is that the industrial cleaning company is at the school now, has been there for a while this morning, and is walking the premises and evaluating the school with our executive director of project management. And they are making a plan for cleaning, which may begin as early as this weekend.
Have they been inside the school?
Yes.
The employee, Julia with the Associated Press, the employee has not been at the school since February 19th. How have they been, when were they hospitalized? Because you mentioned they are hospitalized.
So there are some details about the individual case in the Oregon Health Authority media release that went out yesterday. The case, as we know, is a resident of Washington County, and they are managing the direct investigation of the case.
Is there a point where you might share some information? I've heard that this individual, again, we don't know who it is, but this is just members of the community talking, and we won't say any identity, but was well loved in the district, and lots of people are concerned and maybe want to help. Is there at any point that this person might be able to be receiving some assistance, or is there some way the community can help?
Thank you for asking if there's some way that the community can help. At this time, we are working closely with the family, staying in close contact, and ensuring the staff person's privacy to the greatest extent possible and until desires differently are expressed. But we are providing support and care for the family from the district leadership level.
And how much exposure did this individual have with students? Was it close contact or was it limited contact?
What we know at this time is that the kind of contact that this person typically has in a day is not the kind that would be required to transmit the virus.
The students.
Correct.
You mentioned you're monitoring kind of absences at the school the past week or so. What have you found thus far with that?
At this time, our district nurse, Ann Nelson, is in close contact with attendance records, with reports of illnesses, with students who may have immune systems that are compromised, and she is working with families and with school personnel to investigate any and all of those reported absences or reports of illness.
Anything out of the ordinary yet?
That's not something that we're prepared to speak to at this time.
Are the steps that the district is taking unprecedented? Have you had to do something like this in the past?
In my time, and I will defer to others who have been here longer, I've been in the school district for 8 months. In my time in this school district, we have not dealt with an illness or virus at this level. I'm sure that there have been times in the past with other viruses that have been moving across the nation.
So you're not commenting if the absences are greater than they are normally? Is there an increase in absences this last week?
I believe that we are not commenting on that at this time. We're still in the investigative phase of that.
Are you gonna have additional, like you said, there's school nurses here, are you gonna have additional medical professionals on hand for parents who might be concerned?
Yes, so Dr. Present, I think, was going to respond a bit to that question, and then I'm sure you'll have a response for this question as well.
So we have no indication of spread of the disease at this time, and if there are new cases that are identified, I assure you we will let you know right away. As far as medical care, we are coordinating with regional healthcare systems and with Oregon Health Authority to ensure capacity for evaluations. Again, if you're not having symptoms that are severe enough that need medical attention, then to protect spread to others, we do recommend staying at home as long as you're doing well.
Dr. President, just because you're here, is there any update on this second individual that was mentioned at last night's press conference that's being tested and waiting for those initial tests? Any update?
I don't have an update on that.
One thing that you and others have mentioned is that, take an abundance of caution and stay home at the first hint of symptoms. What do you have to say for people for whom that might not be an option? Parents that have to go to work and don't have any sort of safety net or don't have a place to send their kids.
Absolutely. So we know that something like a school closure can be incredibly impactful on families. We are recommending to businesses in our community to evaluate their sick leave plans and ensure that there is capacity for people to stay home when they are ill or when they have to care for an ill family member.
Dr. President, obviously we don't think that there's widespread here in the school, but as you can understand at a time like this, a lot of misinformation circulating.
Yeah.
What can you say about kids being susceptible to this versus adults? Are kids less at risk overall than adults, or what?
So what I can say is that we are still evaluating what this looks like in the United States. We've had very few cases. The information from around the world suggests that children have milder illnesses, that the people who have severe illness tend to be older and have underlying medical conditions. We also know that types of coronaviruses are widespread as common colds. So many of our common cold viruses are coronaviruses. And we are still learning about this virus and whether the prevalence of common colds may increase sort of the resilience that children have around that.
If your staff is starting to come down with an illness, whether it be this, are you able to bring in people to staff, adequately staffed? Is there like a pipeline for that?
Are you speaking about the schools?
Yeah.
So if our staff are demonstrating being symptomatic, we would like for them to stay home and seek medical attention as appropriate. And we will ensure that we have adequate substitute staff or other. Our district staff will also step in as needed to ensure that we have classrooms that can run as usual in our schools.
And what events were canceled this evening? I know that you guys canceled some events. Is there some specific ones you can cite that have been canceled?
One in particular was that we had a basketball tournament that was going to be happening in our schools today and this weekend, and we have let everyone know that we are not going to be having any visitors in any of our schools, again, for an abundance of caution. But that's one offhand that I can tell you about is the basketball tournament.
Was that the high school or middle school?
In many of our school gyms.
Oh, it was like
Mhm.
a multiple
Mhm.
event, multiple building event.
I understand this next question isn't, more important than the health of your employee, but I'm just curious, with several days now that you will be closed, what's that look like? Are you tacking on days at the end of the year? Have you, looked out that far?
At this time, we have enough instructional days built in for snow days and the like that we don't need to consider tacking on days, but we would do that if needed if we extended the school closure.
Are you able to share the employee's age and what his condition is looking like right now?
We're not going to share any additional information about the employee.
Age Alvarez, Zeller, Investigator Review. Are there any other health and safety measures you're taking in the other schools, whether that looks like extra hand sanitizer or from the custodial staff to do anything different?
We have asked our custodial staff, we are all hands on deck this weekend, and we've asked our custodial staff and our building engineers to be in buildings, ensuring a deep cleaning and disinfectant of all surfaces in our schools before opening of school on Monday, and we'll have additional staff as needed. We'll hire additional staff if needed as well.
How are you making sure they're protected?
We have our executive director of project management who is working closely with Oregon Health Authority and following guidelines from the Centers for Disease Control in all of the cleaning methodologies, and he is overseeing them at Forest Hills at this time, and also will be overseeing them in all of our buildings.
What does that look like? Of course, we've seen gowns and things like that. Is it a simple mask? Just curious specifically what
I
that
think
looks
I'll
like.
defer to Dr. Present on this.
I would have to refer to the Centers for Disease Control and Prevention guidelines on cleaning. Gowns and masks are, there are some specific guidance for healthcare protective equipment. Excuse me. So there are some very specifics around types of masks for healthcare personnel who are treating and evaluating people. There are some guidance on basic masks for cleaning as needed if there are aerosolizing procedures.
Dr. Taylor, I'm sure you've been following coronavirus news, since, it's been in the news now for weeks. Just personally, how surprised are you that it's hitting this close to home? When you got that call yesterday, just kind of walk us through, did your jaw drop?
So our team has been responding in early stages by planning for the potential of the virus showing up in one of our schools or in our community. So plans have been put into place for how we would respond. We have been on phone calls with the Oregon Health Authority, our local education service district as well. I would say that when I did get the call yesterday, I wouldn't say that my jaw dropped, but it was definitely a very solemn moment when Dr. Present and the gentleman from Oregon Health Authority said, "Are you sitting down? Do you have time? We have a serious conversation to have." And from that moment on, which was literally minutes before the press conference last night, the team and I were in high gear. And so Mary Kay and I were working closely here at the building until close to midnight last night. And the rest of us were working remotely via text message, email, phone calls, group calls, conference calls. So we have been in high gear since that moment, which was just before 6 p.m. last night.
Is there going to be any effort, in maybe in the school when it reopens, because it doesn't look like it's a 2-week time frame, it's a little bit like it's a half a week or a week. Is there any effort to like have those, devices to take your temperature on the forehead, you know, that we've been seeing nationally? So we've been watching a lot of coverage nationally. We've been seeing, you know, people get the temperature reading off their forehead and things like that. Is that something that maybe might be happening in the school when the kids return as an abundance of caution?
Well, first I want to speak to the beginning of your question. The school will have been closed, yes, until next Wednesday, reopening on Thursday. And that is a 14-day period from last exposure that we're aware of. And we have been, as I've said, in close contact with the Oregon Health Authority, who has told us that they are planning to bring in additional supports, and any of the provisions that you're describing that we need in our schools, we will be sure to have on hand.
Are you going to be, is there any discussion of how you're going to talk to students about this, especially young students who might be anxious or, you know, just hearing it on the news and stuff? I know it's in my school. I don't know if there's going to be talking to teachers about how you talk about this with the students and stuff like that.
Yeah, I am certain that after this gathering, the team and I are going to be working together throughout this afternoon and weekend to begin communications with our communication director as well, and in our work with the Oregon Health Authority to establish communication for our school administrators, our teachers, our community, and our children. We want to support being proactive, decisive, and action-oriented, and also we want to support being calm and steady in our response.
And to that point, what message do you want to send parents today?
As you heard me say earlier, I want to ensure parents that we are in close, continuous, and constant contact in monitoring the situation with those that you see here, our school board, our school district team, Oregon Health Authority, medical professionals, Centers for Disease Control, and that we are confident in our decision to close Forest Hills. We are monitoring any additional information that we have to make decisions about any potential next actions. We want our parents, our community, and our students to take an abundance of care themselves. As I said earlier, if they are feeling ill in any way, to be in close contact with their medical provider and with our public health officials. And if they are symptomatic, we would like for them to stay home from school or work, and to be in touch with the entities that I just named so that we can have a thorough investigation of any reports.
Have you got a lot of calls or contact from parents? What's the vibe like? Are they phone ringing off the hook?
I would say that Mary Kay Larson, our communications director, can respond to that.
Whenever we make an announcement like this, we do receive quite a few, mostly emails. And I would say it's questions, and as we get more information, we've been able to share that, and I think that that has helped quite a bit. Yeah, I mean, obviously there's concerns and it's worrisome, but our parents are simply looking for more information, which is what we hope we provided today. So, with that, I'm going to say if there's any last questions, and we'll wrap up today. Anyone? So thank you for all being here, and we'll be in close contact with all of you as well as we know more. Thanks.
Thank you.